Thank you, Professor Rao, for joining the chat. Let's start from your personal experiences. To summarize China's development in the healthcare system over the past 75 years is a bit difficult for anyone born after 1949. But you have an advantage, right, that not so many people could enjoy. Your father and uncle, who were born in the pre-People's Republic era, were both doctors, and they must have told you some stories about the country's medical care in the early days after the founding of the People's Republic. So help us understand what kind of changes the country's healthcare sector has gone through over the past 7.5 decades.
Well, I'm only in my early 60s.
Right.
So if I have to really think about it, I mean, 100 years ago, China doesn't have a medical care system. You would have doctors and no nurses, and there's very few hospitals. And so the idea of a healthcare system is quite new. I think it's less than 75 years. I think after the founding of the People's Republic, then there's a lot of emphasis on public health, on controlling infectious disease, epidemics caused by infectious disease. The classic types were wiped out by public health policies and by vaccines. And that's the first major contribution by the People's Republic. And so most of the big infectious diseases are under control. That's a major achievement. And that's not easy to do when the country 75 years ago was still economically poor and the population was already very large. So I think that achievement was actually amazing. Then slowly building up the antibiotic and pharmaceutical industry was, I think, the second achievement, because without those common, what is now considered common medicines, most people would have died from very small infections. And so those two, I think, are clearly nationally organized efforts to improve the really public health and the common medicines. The health network for caring for patients, that came out very strangely. It came out actually during the Cultural Revolution, when there was lots of things that went wrong. But there was one idea, that is, you need to provide health care to everyone, including farmers. And that number of people is very large. And in the 1970s, when they did that, it looks incredible. And it was very primitive. And but it started the idea of national coverage for most people. So I think that's an idea that has been evolving for a while. The best coverage they provided was for people who have a job. But that's relatively easy, and one would argue that's a little biased. But to provide healthcare to the others took much longer time and efforts. And I think to this day, you cannot say we know definitely whether we are having the best system versus we need to learn from other countries. And they're talking about different countries. I mean, including Cuba has a pretty good healthcare system, and there are other countries that we can learn some lessons from. So I think that's an unfinished job, how to provide the best care at the expenses people can afford.
So what level are we at right now? Are you just compared us, our system to the Cuban system. Are we on the same level, or?
I think the most difficult dilemma all healthcare system faces is providing general coverage of many, many people. versus provide the best healthcare for individuals. Those are intrinsically antagonistic. And if you only care about the best quality, then the cost goes high and favors a few people. If you care about the general service, then the quality sometimes suffers. So I think that's the balance every country, every population have to decide from time to time which way you go. When you went one way, the other way will be complaining. When you went the other way, these people would be complaining. So they'll be endless.
Right, always unsatisfaction over there.
It's impossible to provide a system satisfying to every single person in a large country.
Indeed, that's reality. We'll dive deeper into that respect later on in the show, but you returned from the U.S. in 2007 to live and work in China. Was it because of the momentum of China's medical development or its insufficient development?
I'm looking at a bigger picture. There's a personal sense of belonging, which is important for me. And secondarily, consider about what you can contribute by what you can do. And when you look at China and the U.S., you can clearly see pluses and minuses on both sides, where you spend enough time and think more fairly about both sides. But on the U.S. side, there's lots of problems. It's very hard to change, and which included the healthcare system. I have been spending a lot of time in medical schools in China, in the U.S. If you look at the U.S., most people complain about health insurance and access. But I was in U.S. medical schools. You can clearly see the medical system and the medical education in the U.S. was already tightly controlled by interest groups. And when you control the supply of medical services, control the entire market. And in the U.S., no one wants to touch that part. And that contributes to the difficulty in solving the whole problem. When there's one part you don't touch at all.
That's a bold assessment.
In China, there's efforts, and there's lots of determination wants to provide a good system. And the major problem, I think, is there's a reluctance on many people in the system to change, and they're afraid of changes that would either undermine their own interest or it would cause instabilities or outpowering of criticisms. And rather than take the criticisms head on and see what we can solve, most people in China run away from criticisms.
Right. You just mentioned, took an overview of the development of China's healthcare system over the, I should say, the past century. Then, when we narrow down to the past 75 years, what would you say has been the most important achievement China has made in this area?
Well, vaccination.
Vaccination?
Yeah.
That's the biggest one.
That's a very clear achievement. The others are not as big as vaccination.
Universal vaccination for the entire nation.
Yeah.
Right. Then what about this? If this is the biggest achievement, what has made this country, able, or what has enabled us to achieve this breakthrough then?
Well, I think with the founding of the Republic, the idea is to serve the people. So there's a determination to make sure everyone's health is improved, and vaccination is the best approach to that. I mean, any kind of anti-cancer drugs or anti-cardiovascular diseases, those serves small populations, but vaccination serves all.
Right. I didn't expect that answer because, people now focus much more on this, what do we call it, the network, the nationwide insurance network. insurance network. It's the world's largest, right? Covering over 95% of the population.
But all the coverages you need to compare with, there's different countries doing that
That's true.
a bit differently, and there are countries that's considered to be better than what we've been doing. And so I think for anything else, you can have lots of controversies. It's very hard to come up with a perfect system. But for vaccination, I mean, if there's no good vaccination done within the first 20 years, 1950s, 60s, lots of us would have died or never born.
Then has the vaccination system evolved over years?
I think the contribution of vaccination cannot be underestimated. It has moved from all government control to allow private sector to move in for vaccination. I think by and large they've done a great job, but people are very sensitive. Whenever there's a small possible complaint, not even a problem, the entire country goes in uproar, and the punishment is very harsh. So I think in general, I believe they've done a very good job.
Right. Then, indeed, like you said, the nationwide healthcare system could be sometimes controversial, right? Those who say that it's a success point to the size of it, which covers 90%, 95% actually of the population, and is something a developed country like the United States hasn't achieved. But those who believe China's medical reform have failed point to this industrialization of the sector, saying it has led to widespread corruption. So what's your evaluation of this?
I mean, over the last 4 decades, if you talk about corruption, there is that in almost every sector. I don't think the health insurance system have done more than the other sectors.
Fair enough.
And the others is, I think, when it concerns health, everyone thinks they are involved. Everyone is sensitive, and so there's more complaints than other systems that may have been more problems, but that people are less sensitive about. And it's reasonable, I think, how to come up with a system that satisfies more. It will be an eternal debate. It would never end. And I want to point out this is that everyone wants to see the best doctor when they have a disease.
Right.
But by definition, best doctor is less than 1%.
That's true.
So it's impossible for 100% of people to see the 1% of doctors. So you will always be unsatisfied because you cannot see the best doctor.
But there's one factor that you can say whether people are satisfied or not is life expectancy rate. So from that aspect, from that point of view, has China, succeeded in reforming the system then?
Chinese people certainly live at much longer lifetime than before.
Right.
And so the general improvement in healthcare clearly is a major contributor. But in most countries, the general economic development by itself already uplifts the age of most people. And clearly we are all live at much longer lifetime. And,
right. Would you call it a major achievement?
But is that an achievement of the medical system, or is that a byproduct of economic development?
Right, that's a good question.
It's very hard to distinguish. As long as we are talking about those two factors, then it has to have a control that your healthcare is better than your economy. And that's why people would point to Cuba, which has such a bad economy, but healthcare is actually pretty good.
Right.
So in that case, the healthcare system must have some component. In most of other countries, it's very hard to distinguish between two factors.
So what's the life expectancy in Cuba?
I don't know.
Right, maybe we should find it out some other day. Well, let's turn to the problems we've been facing. You've published an article pointing out the problems with China's epidemic prevention system. Can you elaborate more on that? Why is such a system important?
As you've experienced, that pandemic mainly caused by infectious agents will not end in the world. There's all kinds of agents, especially viruses, that's going to come up here and there.
Right.
So we have to have a system that allows us to have an early warning system and an effective system to deal with it. Every country has given up on that a few decades ago. They believe infectious disease and the pandemic caused by infectious disease is a problem of the poor countries. So once they feel they've been entering the developed country category, you don't need to worry about it. So every country has been lowering down the alert system. And so that I don't blame China. But the problem is when in 2003, when the first coronavirus pandemic, SARS happened. Then after that, clearly, then we need to build up the system. So my complaint is that for China, after 2003, and before 2019, that alert was not built up. The country has put in money, and there's been people paying lip services, but a system that was supposed to fight acute pandemics, most of the money has been used by people in the system on chronic diseases.
All right.
They still did not believe there will be another pandemic. So they put the money to build up a system to care about chronic diseases. And chronic disease is important, but it's not. It should be separate from the alert system for acute diseases. So that's a major failure. And I think China was ready to criticize that system. But when Trump started to blame Chinese government for everything, China decided not to provide more excuses for them. So actually, those people actually escaped the scrutiny by our own people.
I can sense some, similar philosophy to Chinese medicine, right? Because prevention is better than cure, maybe.
But that's a general idea.
Right.
Prevention is better than cure. But for a lot of diseases, you don't have prevention.
What about the system?
But for
epidemic prevention system.
For lots of chronic diseases, you don't have a prevention system. You don't build up the national system to put up alerts for a few people.
Right.
But for acute infectious diseases, that's very different. That's clearly nationally organized efforts. So when the government puts in money for that, what they should have done for those 16 years is put major efforts to build up the system, which I think they've done some. It's not they've done nothing,
right.
But they haven't done enough.
All right. I remember the article you published on the problems of the epidemic prevention system was last year, 2023, right? And that's also post-pandemic. So then why would you say loopholes still exist in China's epidemic prevention system after the nation actually experienced two major epidemics in less than 20 years?
I think lots of efforts have been made in the last few years
All right.
to improve the alert system, but I don't think it's enough. Fundamentally, you need to have good medically trained public health people to join the system, which I can see from medical school side. And if you don't see lots of good young people joining the system, how are you going to improve it? You're not going to use robots or AI to deal with it. These are new problems. AI can deal with old problems. For the very new, very unknown. AI is not that capable. We need to have real people joining the force. So, where are the efforts? Has there been any change that would make sure the people fighting the pandemics on the front line will be treated, honored, paid better, or equal to doctors in regular hospitals? And if they are not, then why would young people join that profession? If good young people don't join that profession, how do you build the system? So I don't see any policy that really came through to encourage that.
So it all goes down to the education system, or?
Well, it goes down to education, encouraging people going that path of profession.
Right.
If before pandemic, after pandemic, you have roughly equal number of people who want to join that profession and roughly equal quality of people to join, then that will be a problem.
Then going forward, is that the most urgent task that the government needs to solve?
It's one of the top. And then you have to have a real system that's different from the previous one that can effectively monitor the situation. What you can see now, you have one virus after another. Like, so if we're going to live with them, we cannot eradicate them, then we have to have a system to deal with them.
Then you are dubbed as a determined reformer in an article carried by the school publication of Peking University. So what does this mean to you?
For me, this is a good time that in China we can do lots of comparative analysis and understand what are potential problems, and that we should then be determined to change what's not so good and build up or establish new systems or reform old systems so that it works better. And especially if you think of pre-pandemic, Chinese economy was pretty good. When the economy is so good, then what you should think about is not just how to spend the money that's earned, but how to really invest in the future.
Right.
Healthcare is very important. And healthcare changes the quality of people, and quality of people changes the economy and changes the nation and the world. And so it was relatively easy at that time. Now, post-pandemic, there's lots of uncertainties. The economy, how the world affairs, problems between different countries is going to evolve, and those adds more complications.
In Chinese history, most reformers suffer tragic endings, including your fellow townsman Wang Anshi, well, who's arguably the most renowned reformer in China's history. So the reforms you are championing right now, what makes you believe you can accomplish the mission?
I'm very optimistic, at least I used to be. And
because?
I grew up being more optimistic, so
All right.
that's by nature.
It's not because that you have confidence in this system.
My criticism usually is because when I see things contradictory to my expectations, I get more angry. But on the other hand, I have a general positive outlook of many things. The other is that I'm not doing large scale like once. I'm looking at in medical care, in education, in science. Those are highly limited issues. And the third and most important point is that when I criticize something, it's usually I have a solution.
Right.
When I don't see a solution, I don't raise my hands.
Okay.
Because if I don't know the solution, why would I criticize anyone else? It's only when I see a clear solution and other people are not doing it out of stupidity or out of convenience or out of the protection of their self-interest. That's when I'm trying to push for reform.
That's called a constructive criticism. So what percentage of those suggestions have been taken by the authorities, or?
if you look within a year or two, very small percentage has been accepted by anybody. But if you look at a longer time point, either they knowingly, acknowledgingly took what I suggested, or they took what I suggested, but don't admit it. So over the long run, I think success rate is 80%. Over the short run, I think it's 5 to 10%.
All right, I can see where the optimism comes from then. Well, then can you...
Take an example. I supported transgenic crops.
Right.
And that's
Which
the
is
first fight I took when I first came back 17 years ago. And those 3 or 4 years, I wrote lots of articles, and I was counter-criticized by many people.
Right.
But the government was not saying anything. But if you look at the last few years, the government completely taken in the supporting transgenic crops, just without loudly announcing it. But if you look at real policies, they've wholeheartedly embraced it. So no one is going to come back to me and say, you were the supporter, you were a good alliance.
But was it a result of the the fight between interest groups, as you said, of like what they
Well, it's interest group. The other is not. It's just more understanding of science.
Right.
And I was very clear in my opinion because I had no conflict of interest, so I can speak more clearly. The others are usually agricultural scientists, so they were labeled as conflict of interest,
Right.
and I could not be stuck with such labels. So, and that's why I did it. But and in the end, most of those in agriculture science who were supporting transgenic crops, now they are put in very good positions, including administrative positions, to carry out the policies now.
All right.
They did not come back to say, thank you, you were our supporters.
But that's obviously silently acknowledged by the authorities, right?
Well, as long as it helps the entire process, I don't need to be thanked.
Right.
I want to see how things change.
Right, fair enough. And back to this healthcare system, can you describe the perfect healthcare system for China in your mind? Does it resemble the European or the US models more closely?
I do not think there will be a perfect system when the country is large enough. And
That's being realistic as a scientist, but as an idealist or optimist.
It's because what I said. Medicine is not producing lots of Apple computers.
All right.
Or everyone wants the best doctor at their beds when they are sick. So that by definition is impossible. So there will always be a compromise of different interest groups. And if you want to provide the best quality, necessarily it's more expensive, and then it favors those with money. If you want to provide the more general kind, then the quality would have to decrease because you cannot make 100 doctors equally good. There's always going to be that one that's better than the other 99. Right? So I think the best would be for different provinces to favor one way or another, while the country provide a general support. But provinces can go one way or another. A more developed province can favor better quality. A less developed province then add on to the general support.
But are we on that track?
We are not. I think, but I think different companies, different institutions can add on to that. And in the U.S., I was in medical school, so the medical school faculty members gets very good healthcare coverage. But still, what we do when we really have real medical problems, we go to find the best doctors we know. It is not really through the medical care system. It's our colleagues who helps each other.
All right.
So that was very clear, even when economically they already spend lots of money, but you still need to find the right doctors.
Then do you think The Chinese medicine would be an answer to this?
Well, there is the Chinese medical practice side. There is the
Right.
Chinese drugs, the medicines side. I think the medical practice side, the contribution will always be around, but it will not be bigger than no matter how much effort you put into. Because Chinese medical practice, no one suppresses it. It's the Western imported modern medicine that slowly took over by free market, not by force. What is uncertain is the drug part, the medicines part. And that part, I think, requires real efforts to find out what's effective, what's ineffective. And so far, there are people pushing for it, but don't want to do the hard work of figuring out what medicines are useful. And over the long run, I think when serious efforts are made, and including my lab works on modern biology, we recently ran into a chemical from a Chinese medicine that clearly has biological effects. And so I think the prospect remains very interesting, but it has to require lots of real efforts.
I know you yourself are not a doctor, but lastly, if you need to prescribe for the reform of China's healthcare system, would you say?
Well, I think openly admit that there will never be a perfect system for any large country.
Right.
And then say at this time point, we're going to seriously study and analyze different countries and think about our pluses and minuses and come up with a reasonably good. But then say, these reasonably good systems, one, we're going to adjust every 5 or 10 or 20 years. Set a time to that. Secondly, we want different provinces to have supplementary policies that's more tailored to your province. Thirdly, different institutions can add on to that, so that by having a general national policy supplemented by provincial policies and complemented by institutional ones, then we try to maximize the number of people who will be satisfied with the system.
Thanks a lot, Professor Rao. It was very.
Thank you.
This is CGTN Radio. Hear the difference.